There's always been a need where patients will come into the emergency department, basically with primary care complaints or things that could have been prevented. It really opened up my eyes to the need for access to primary care, especially in our hometown community of San Antonio.
My long-term goals for MedBerry is to be a staple in preventative care. Everybody deserves proper care. Everybody deserves education about how that they can better their lives so that they can go out and do something that they truly love.
I was born and raised in San Antonio, Texas. Grew up here, my family's from here. People always ask me, how long have you been a doctor? So I graduated medical school in 2016, UT Health Medical School. 4-year program, and you graduate with your doctorate in medicine. First 2 years are very rigorous. Second 2 years, you actually go over to University Hospital and other little hospitals around the area and do your clinical rotations. After graduating medical school, my family and I went up to New York, and I did my emergency medicine residency there. 3 years, right on the edge of Queens. And then after graduating, moved back to San Antonio to practice. So to go back to the question, I've been officially practicing on my own for about 5 years, going into my 6th year. Before MedBerry Clinic, from the beginning, I was working in the emergency department as an emergency medicine doctor. I had a leadership role as a medical director for one of the ERs here, so doing some administrative work on the side. And then in addition, I also had a couple different companies that were clinical laboratories doing drive-up COVID testing. The stress of the pandemic, through the emergency department, initially we had no tests available. We didn't really know how to treat COVID. We knew how to treat all sort of respiratory patients, but specifically this one virus was difficult. And then there was all the fear surrounding it, not knowing what was going to happen that day, if we were going to get overwhelmed with patients or if sick patients were going to be coming in. But that's kind of what emergency medicine is, and so there's a big factor of that's what I trained for, and I enjoyed it, and it was very fulfilling.
Were you guys able to continue to spend quality time together as a family?
Yeah, absolutely. I mean, we spent a ton of time together during that period. I think, I taught my daughter how to ride her bike. My wife started teaching our son how to play tennis, and now he still loves to play tennis to this day. I think mental health is a very important topic right now. Part of why I wanted to become a doctor surrounds mental health as well. What drew me to a role in healthcare is my dad had some medical issues, and I saw a very compassionate doctor and a friend help him. And it was then at that point that I decided, if I have the ability to help people, that's what I want to do. My past, my training, and the future, and then combined all with the pandemic, really brought a lot of that mental health and preventative care kind of to the forefront of my mind, which is really where MedBerry Clinic ties in. We offer preventative care, primary care. We can do urgent care, so if you have any urgent issues, we're always happy to see you. We also do a lot of mental health care, so treating anxiety, depression, ADHD, addiction. Really whatever we can, we will try to help. The goal of MedBerry, and really the mission, is to provide high quality, affordable care to all patients, and to make it easy, to go beyond providing care, but to really take care of the whole patient from a holistic point of view.